I'm Gabby Karatka, a first semester nursing student. Today's date is 10/31/19. It's 8:45 and I'm going to do a female indwelling catheter. So the first thing I've done is I've assessed my patient's condition, the order for the catheter, and the size of the catheter, and I've also assessed when their last void time was. I've also gathered all my equipment here, so now I'm going to go ahead and go into the room. Hi, Miss James. I'm Gabby, your student nurse today. Today I'll be doing a catheter placement. So can you tell me your name and date of birth? Okay, awesome. So now I'm going to go ahead and perform hand hygiene and raise my bed to working position. And I'll lay him in supine position. And I've pulled my curtain for privacy as well. Alright, first thing I'm going to go ahead and do is lower her blankets down. And just put on clean gloves while I clean her peri area. And I'm going to use a washcloth to do so. Alright, Miss James, I'm going to go ahead and clean your peri area. Okay, and I'll discard of that in my gloves. Maybe. There we go. Perform hand hygiene once more. And now I'm going to go ahead and position my patient with her legs sprawled in the butterfly position. So I'm going to set my kit in between of her legs. And I'll go ahead and open it up. And now I'll go ahead and put on my sterile gloves. I'm going to go ahead and unfold my sterile field area. Place it under the patient. And I'm going to go ahead and discard of that because I won't be using that for the female. Get my swab sticks ready. And before cleaning the area, I'm going to go ahead and lubricate the tube 2 inches of the catheter. And I have some lube in here in my tray already. And I'm going to go ahead and apply my syringe so it's all ready. Alright, and now I'm going to go ahead and start with my swab sticks. So that my left hand is my non-dominant hand, so it's going to become unsterile while I do so. So Miss James, I'm going to go ahead and touch you and just spread her folds. Clean one side and discard. Go to the next side. Clean it and discard. And I'm going to go right down the middle with the last one. And discard of that. So now I'm going to go ahead and take my tube, insert it 2 to 3 inches, and once I meet urine return, then I'll go ahead and insert it 2 more inches. So Miss James, just go ahead and take a deep breath in and relax. And I'm going to go ahead and insert this tube. Alright, so now I've seen urine. So now I'm going to go ahead and insert 2 more inches and inflate my tube, or my balloon. So now that I'm done with that, I'm going to go ahead and just give a little tug on my catheter to make sure it's in place. Take off my gloves. and attach. I'll apply clean gloves for this. And I'll secure my catheter to her leg, making sure that she still has enough room to move around so it's not too tight on her leg. And when I'm taking my catheter bag out, I just want to make sure there's no major loops in it while I'm hanging it. And I'm always going to hang it below my patient on a non-movable part of the bed. So now I can just go ahead and clean this all up. And also at this time, if the doctor ordered a urine sample, I would go ahead and collect that at this time. Also, just make sure that she is voiding into the bag, and examine the urine if I needed to. Now, perform hand hygiene once more. Get this out of the way. Reposition my patient to a comfortable position for her. Lower the bed down. Up. And I'll go ahead and document the type of catheter and the size that I used. If I did collect that urine sample, I would document that as well. And then I also dated, timed, and initialed the catheter that I did.